Good evening, NY14. My name is Carla Santillan-Guerrero, and I'm with the Office of Congresswoman Alexandria Ocasio-Cortez. Thank you so much for joining our town hall tonight. Before we begin, we're just going to go over a few notes of housekeeping. I'm so sorry, give me 1 second. Thank you so much for waiting. I apologize for that. If you are logged on to the Zoom meeting, please use the Q&A feature. We prioritize questions from constituents, so please mention your name and neighborhood when you send a question. Alternatively, you can send an email to aoc.townhall@mail.house.gov or call us at 718-662-5970. Our staff is also available to support with any technical difficulties that may occur. Our team members will also be monitoring the inbox and phone. We're also live on YouTube, so please feel free to visit our YouTube for live stream. CART open captions is being provided by All Hands in Motion. If you click the link in the chat, it will take you to a website where you can view the transcription. Before we begin, we will be going over the agenda. For today's town hall, we will hear from New York City Health Commissioner, Dr. Dave Chokshi, regarding the current state of the pandemic and what we can expect for the months to come. In light of the recent fires, the Congresswoman will discuss winter fire safety and resources available to tenants and homeowners. We will then open it up for Q&A from constituents. Finally, we will transition to a press gaggle for any reporters who have joined us this evening. And now I'd like to introduce the Commissioner of the New York City Department of Health and Mental Hygiene, Dr. Dave A. Chokshi. Dr. Chokshi most recently served as Chief Population Health Officer at NYC Health and Hospitals. He has taken care of patients as a primary care physician at Bellevue Hospital since 2014. Dr. Chokshi's prior work experience includes positions with the New York City and State Departments of Health and the Louisiana Department of Health. Dr. Chokshi, we invite you to share your remarks with our constituents.
Thank you so much, and good evening to everyone. Thank you to Congresswoman Ocasio-Cortez, as well as her office for inviting me to speak on such an important topic. And look, let me start by saying that to say that it's been a long, hard, trauma-filled 2 years would be an understatement. And I particularly want to acknowledge that the last several weeks have been extraordinarily difficult for so many families across New York City, not just because of Omicron, but because of the tragic fire, because of the episodes of violence that have affected our communities, including the shooting, the very frightening shooting at Jacobi Hospital, with some of my valued and beloved healthcare colleagues there. So your district really has borne the brunt of so much of what we've experienced with the pandemic directly, as well as those reverberating effects. You've lost loved ones, jobs, businesses. We've all missed major events and much needed social interactions. But at the same time, we have shown a remarkable resilience. And by following the science and caring about each other, we do continue to flatten wave after wave of COVID-19. The Omicron wave in particular has touched everyone in some way. But again, New Yorkers have stepped up, and the progress that we're now making is due to your hard work. I recently visited our Health Action Center in Tremont, and I saw our community partners handing out rapid test kits to New Yorkers with the focus on our neighbors in NYCHA housing. And over the holidays, I visited my local neighborhood hospital, Elmhurst, and I saw our dedicated, although often exhausted, healthcare workers who have worked tirelessly to keep their neighbors healthy. Throughout the entire pandemic, New Yorkers have worked to keep each other safe. And I take great pride in saying that this is such a major part of what makes our city so great. So in terms of where we stand right now, we have climbed down from the worst of the Omicron peak, but we know we have more work to do. Our 7-day average of daily cases is now below 8,000. It's about a fifth of our peak, which was nearly 43,000 cases a day earlier in January. And similarly, we are seeing a decrease in COVID-19 hospitalizations from a total of about 6,500 patients hospitalized citywide on January 11th to under 4,700, according to the most recent state data. Let me be clear, these numbers are still very high, meaning community transmission remains widespread, and I and all of us will have to continue to follow these trends closely. And I always ask us to remember that these aren't just numbers. These are our friends, our family members, our teachers, they are bodega owners, nurses. We take all of these precautions to protect not just ourselves, but also that broader community. So we urge everyone to take simple steps to prevent more cases, hospitalizations, and deaths. Get vaccinated and get boosted. Wear a mask in public, particularly a high quality one like a KN95, KF94, or an N95. Continue to get tested and stay home if you're positive or feeling sick. And now I'd like to just repeat some of those remarks in Spanish, but I'll be the first to admit that my Spanish isn't completely fluent, so please bear with me as I go through those same remarks. Esta ola de Omicron nos ha tocado a todos de alguna manera, pero los neoyorquinos han dado un paso al frente y el progreso que estamos logrando se debe a su arduo trabajo. Recientemente visité nuestro centro de acción de salud en Tremont y vi a nuestros socios comunitarios repartiendo estuches de pruebas rápidas a los neoyorquinos, con un enfoque en los residentes de NYCHA. Y durante las vacaciones de fin de año visité el hospital local de mi vecindario, Elmhurst, y vi a nuestros trabajadores de atención médica dedicados y agotados que han trabajado incansablemente para mantener a sus vecinos saludables. A lo largo de esta pandemia, los neoyorquinos han trabajado para mantenerse a salvo unos a otros. Esto es parte de lo que hace que nuestra ciudad sea tan grandiosa. Hemos descendido de lo peor del pico de Omicron, pero sabemos que tenemos más trabajo por hacer. Nuestro promedio de 7 días de casos diarios es menos de 8,000, aproximadamente una quinta parte de nuestro pico de casi 43,000 casos al día a comienzos de enero. De igual manera, estamos viendo un decrecimiento en las hospitalizaciones por COVID-19. Permítanme ser claro, estos números siguen siendo muy altos, lo que significa que la transmisión comunitaria sigue siendo generalizada. Estos números no son solo números, son nuestros amigos, familiares, maestros, dueños de bodegas y enfermeras. Tomamos estas precauciones para protegernos no solo a nosotros, sino también a nuestra comunidad. Por lo tanto, urgimos a todos a tomar medidas simples para prevenir más casos, enfermedades y muertes. Vacunarse y colocarse la dosis de refuerzo. Usar una máscara en público, particularmente una de alta calidad, como una KN95, KF94 o una N95. Continuar haciéndose la prueba y quedarse en casa si resulta positivo o se siente enfermo. Y ahora regresaré al inglés para el resto de mis comentarios. I know that during this Omicron wave, many of us heard about people, including New Yorkers who are vaccinated, who got COVID. I want to be sure that you know that this is not a cause for confusion. If you are vaccinated, you've taken the most important step to protect yourself from severe disease. And for that, I want to be sure to thank you, because you also help to protect our hospitals and health workers during a very difficult time. Our most recent data continue to show that unvaccinated people are over 8 times more likely to be hospitalized than those who are vaccinated. Now, the next phase for us is it's time to stay up to date. If you haven't already gotten your booster dose, please join the over 2.6 million New Yorkers who have taken that important step. Recent data published by the CDC showed that booster doses are 90% effective in preventing hospitalization, even during Omicron. As the city's doctor, I want to see cases plunging rather than plateauing. The steps that I've just talked about will help us to move to a different phase of COVID-19, and I hope before too long an end to the pandemic. But when we talk about living with the virus, that cannot mean ignoring that too many New Yorkers continue to die from COVID-19. We must keep our aim on preventing suffering and saving lives while minimizing disruptions to society. With vaccines, high-quality masks, testing, staying home if you're feeling sick, and yes, a little more fortitude in the face of fatigue will continue to shape our curve, beat back Omicron, and save lives. Thank you again so much for having me as part of the virtual town hall, and I look forward to your questions. Thank you again.
Thank you, Dr. Chokshi, for sharing your insights and recommendations with our community. It is so much appreciated. Due to unforeseen scheduling conflict, we will jump into a Q&A with the commissioner as we await the Congresswoman. So starting off with one of the questions, as a recent university student, what are the expectations for the effects of the Omicron surge on education, especially colleges and universities?
Yes, thank you for this important question. We have seen, Omicron has affected colleges, universities, schools, other educational settings. Thankfully, it does appear that the worst of those effects are abating now, meaning we have less cases in those settings and less of the staff in those settings are infected, meaning that they can resume, a semblance of normal operations. The details of exactly how your college or university, will be dealing with Omicron is something that, of course, they will be able to provide the specifics on. But what I can reiterate is the importance of getting as many people in those settings vaccinated and boosted. And some places are moving to requiring booster doses as well, to make sure that we have that at the highest level possible. I do recommend that, particularly if you're in those settings, you continue to wear a mask, optimally a high quality mask, particularly when you're indoors, and to take precautions. If you're going to a large indoor gathering, whether it's a party or something else, then you should get tested and always take care, not just for yourself, but other people whom you may be exposing, like a grandparent or another loved one, who may be at higher risk. So that's my advice right now. I do hope that the situation will continue to improve, and if we take those steps, we can help to make that the case.
Thank you so much for addressing my question. We have other questions from constituents as well. The Johnson & Johnson vaccine has a risk for blood clotting. Are there any side effects related to Moderna and Pfizer vaccines?
Thank you. This is also an important question. There is a very small risk, but an important one related to blood clotting for Johnson & Johnson, as was mentioned. It appears to be, most significant for younger women with respect to the rate of that side effect. But with that said, millions of people have safely received the Johnson & Johnson vaccine, including myself, and it has had tremendous benefit with respect to protecting people from COVID-19. In terms of the side effects, related to Pfizer and Moderna, which are the other two vaccines that are currently authorized, the most important thing to know is that the benefits of vaccination far outweigh any small risks. The ways in which COVID-19 affects the body, including the long-term effects of COVID-19, are what we are trying to protect against. The vaccines do that, and they particularly help to protect against the worst outcomes, whether that's needing oxygen or a hospital bed or an intensive care stay with a breathing tube. So all of those are what we have to keep in mind when it comes to the benefits and the risks of vaccination. With that said, there are some side effects that people should know about. The vast majority of these side effects are mild to moderate. Fatigue, some pain at the site that you get the injection, some headache, and they usually go away within 2 to 3 days. For the Pfizer and Moderna vaccines, there are very, very rare instances of more serious side effects. The most important ones to know about are severe allergic reactions. Those are on the order of about 1 or 2 per million people, who get the vaccine. And importantly, if you have other types of allergies, you are not likely to be at increased risk from a severe allergic reaction. So that's all to say, if you have allergies, unless it's to the specific components in the vaccine, you can feel comfortable and safe in getting the vaccine. The other side effect that I do want to mention is heart inflammation, what's called myocarditis medically, and that occurs more commonly among younger men. This is also, again, a very rare side effect, and the benefits do outweigh the risks. And so I recommend it strongly, even for younger men, but it is a side effect to be aware of, and for people to seek care if they develop, chest pain or other symptoms after having received one of those vaccines.
Is the first 100-dose gift card so if you get a vaccine in the city-run site? This is also another question from constituents.
Yes, this is one I can answer briefly. Yes, we are still offering the $100 incentive at city sites. You can go to nyc.gov/vaccine finder or call 877-VAX for NYC. If you're interested in getting that incentive and you haven't gotten your first dose, please do, and they can help to navigate you to a site that offers it.
Thank you for that. So this one is from the Pelham Bay area. Does Dr. Chokshi have any updates on Mayor Adams' mental health plan and NYC? Kind of a transition away from COVID questions.
Yes, well, I'll start by connecting the two, actually. I mean, mental health is so important during COVID-19. It's one of what we at the health department call the parallel pandemics, because people have suffered so much grief and stress and trauma over the past 2 years. So I very much appreciate, asking about this question. And Mayor Adams has demonstrated that, he is very committed to addressing mental health issues and continuing the investments that have been made over the last several years. So stay tuned, for further plans related to them. Right now, there is a particular focus on outreach for people with serious mental illness, getting them connected into care, deploying more mental health workers into places like subways, into places where we know we can help people who are experiencing homelessness as well, and offering the care and the services that we know can help people get better. The other thing that I'll say is that for anyone, if you yourself are struggling with a mental health issue, or a family member or a loved one who is, the best way to get them connected to care is to call 888-NYC-WELL. We're able to offer support 24 hours a day, 7 days a week. That includes texting support. If you just Google NYC-WELL, you'll be able to access that as well. we have taken care of, hundreds of thousands of people through that service over the past 2 years, but we want to make sure as many people know about it as possible. And importantly, you can also get service in your native language as well. Thank you.
Thank you. So I received 1 dose of the J&J vaccine, and then I received the Moderna booster. Does this mean I need like 2 more doses of the Moderna to be considered fully vaccinated?
No, that is not the current recommendation. You are considered fully vaccinated and up to date if you've gotten the 1 dose of J&J, and then the Moderna or Pfizer at least 2 months after that dose of J&J. The constituent who asked the question is in the same boat that I'm in. I received J&J for my first dose and Moderna for my second dose. I have not received a subsequent dose after that. If the science shows that that's necessary and it confers beneficial protection, then we will update our recommendations. But right now, you're safe and protected with the regimen that you've already received.
Thank you so much for that answer. Do we have any updates on vaccines for children under 5?
I'm also following this very closely. I have a daughter who is who's under 5 and not yet eligible for vaccination, and so I know there's so many parents who feel anxiety about this. And the short answer is that it will take a little bit more time. I wish I had a better answer, but it looks like the spring of this year, maybe April, possibly May at the earliest, with respect to having a vaccine for kids under 5 that has gone through all of the studies and then the FDA process. I wish it could be faster, but at the same time, we do have to allow science to run its course. We always want to make sure that any vaccine that does get out onto the market is safe first and foremost, especially for our kids, and also effective. So that will take a little bit more time.
No, thank you. I have 2 young nieces, and that was a concern of mine as well. So thank you to the constituent who reached out with that question. This one is from Phyllis from Sunnyside. Do you believe we will all eventually get COVID, especially Omicron?
No, I do not. I know that there is some conversation about that out there, but although Omicron is extraordinarily infectious, that doesn't mean that 100% of people will get infected. And so we do have to continue protecting ourselves and others, particularly people who are the most vulnerable to serious outcomes from Omicron. So I get worried when I hear about this because it makes me think that people may just be throwing caution to the wind when it comes to protection. But Omicron, is different in some ways, but in this way it is not. It's still better not to get COVID, because of the long-term effects that COVID can have, because of the possibility of severe outcomes. So even though it is much more easily spread, that doesn't mean that it will spread to absolutely everyone.
Thank you for those comments. So we also have another question coming in. Do you see us needing a booster after a booster as new variants keep rising? Like, is this going to be like a continuous process?
Yeah, this is also something where the science is not definitive. It hasn't yet been settled. So the honest answer is it's possible. Right now, the scientific evidence does not support an additional booster. So that means if you've gotten 3 doses of the mRNA vaccines, that's Moderna or Pfizer, you're considered up to date. Or if, as we heard from the previous constituent, the J&J plus an additional dose, then you're considered up to date. We'll have to see, if there are other variants that emerge, and we have to see if immunity wanes, meaning it decreases over time, then it's possible that another booster will be required. It may be something that, we only need ahead of the next winter season. It may be something that we have to factor in, just like we get the flu shot every year. All of that is still not yet settled. So what I can say is that, the health department is committed to keeping people updated and will always follow the scientific evidence in terms of the guidance that we provide.
Is there any timeline for access to the COVID antiviral pills?
Yes, I'm pleased to say that the antiviral pills are now accessible in New York City. They are, in general, being used to treat people who are most vulnerable or at highest risk of severe outcomes. For example, people with weakened immune systems or older adults. And so they are still in somewhat limited supply, but the pills are available now. So you can speak to your doctor about that. The things that I want people to know about it is that they are most effective if you start taking them very soon after you're diagnosed. So that's why it's important to get tested quickly if you have symptoms. If that happens, if you test positive or if you have symptoms and are confirmed to have COVID, then you should talk to your doctor about the possibility of getting either the pills or monoclonal antibody treatment, which is another type of treatment for COVID-19. And if you don't have a doctor for whatever reason, you can call 212 COVID-19, speak with one of our nurses on that phone number, and they can get you connected to a virtual visit with a doctor if necessary as well.
Thank you so much for insight on that. I was wondering about that as well. We have another question coming in. Why do so many testing sites just have one person testing at a time and lines over 100 people in the freezing cold? Why are there not mass multi-person sites like with the vaccine?
Thank you for this question. There are such sites in terms of being able to test multiple people at a time. The health department runs several sites like that. Our colleagues at Health and Hospitals also do run those sites. It is true, during the worst of the Omicron surge in December and early January, there were lines at the testing sites. We saw unprecedented demand for testing, and I do wish that we were able to take care of people even more quickly than we did during those weeks. But right now across New York City, there are over 250 city testing sites that are operating. There are not lines for testing at the vast majority of them. You can go to nyc.gov/COVID test or text COVID test to 855-48 to find a site that's close by to you. We're also distributing rapid test kits that people can use at home. And so, those are also available if for whatever reason there are lines at a particular testing site.
Yes, and both of those links are actually in the chat right now. And this question is from Astoria. So personally, I've also been keeping track of this because I've seen the CDC's recommendation shift a lot. So why has the time of isolation decreased to 5 days?
Yes, this is something that we've been following closely. And again, we have to follow the scientific evidence with respect to these changing recommendations. Basically, the CDC put out this recommendation, which is for most people, although not all people, to shorten the isolation period to 5 days, provided that you are either asymptomatic and you've remained asymptomatic, or you have very mild symptoms and they've been improving. For example, you don't have a fever for a certain period of time. In those cases, people can emerge from isolation provided that they continue to take precautions at least for an additional 5 days. That means wearing a high quality mask, making sure that you're not doing activities, as you would per normal and exposing other people. And this is really to try to strike the balance between minimizing the disruption of COVID to society. For example, allowing our healthcare workers to take care of other people while trying to reduce the chances of onward spread. The data indicates that people are less likely to be infectious, after 5 days, but less likely doesn't always mean zero, which is why we have to continue following those other precautions. But I do want to acknowledge that this has been a bit confusing. It's hard to keep up with all of the different types of guidance. So if you have any questions, our health department website, you can go to nyc.gov/COVID19 and access all of our up-to-date information if you have specific questions about your situation, or you can always call us at 212-COVID-19.
Thank you so much. How worried should we be concerning the 2 new Omicron subvariants?
Yes, there is one subvariant of Omicron that we're following closely. It's called BA.2, if those of you are reading about it. Right now it's something that we're following, but it's not a cause for significant concern. What we're seeing is that it is growing in terms of the proportions in places like Denmark and the UK, but we haven't yet seen that has any major real world impacts that are different from Omicron itself, from the original variant that we have become familiar with. So what I can tell you is that we are following it. We will keep people updated if those developments change. But right now it's just something that scientists need to investigate. And not yet, causing any change in terms of our public health recommendations.
Thank you so much. So this question is the last question, and it's from Robin from Astoria. As a health professional, how do you maintain optimism in the face of COVID-related misinformation?
Well, thank you so much for this thoughtful question. And I'll say just to start that I feel very optimistic, despite all of the challenges and the stresses of the past 2 years. And the reason is because there have been so many examples of heroism and people pulling together when New York City needed it the most. Whether it was, those terrifying times in March and April of 2020, the ways that people banded together to make sure that that our neighbors were cared for, that we were able to make sure that our healthcare workers were supported as they were saving lives. To, in more recent months, ensuring that the most vulnerable among us are protected, and that we all take the steps that we need to protect them. So I derive a lot of my optimism from the privilege that I have to observe the many ways in which New Yorkers continue to step up. And the constituent asked about misinformation in particular, and I would extend that to the problem of misinformation. But really, this is up to all of us, right? The way that I think about it is that we have to make sure that good science-based factual information spreads more quickly than the misinformation, and in some ways spreads more quickly than the virus itself. That's something that's under everyone's control. It's not just my job as the city's doctor or even the health department's job. That's what each of you can do to make sure that you're bringing, for example, the information that we've talked about today to your family members, to your loved ones, people who may be exposed to misinformation, whether it's on social media or somewhere else, and make sure that you're providing a counterbalance, because people trust you. Your loved ones will trust you. And so if you're the one delivering that information, often that means much more than having it come from me or another government official or even another doctor or health professional. So I'm counting on each of you to be ambassadors in that way and to combat misinformation. And that will keep me optimistic about the future of our city and our ability to beat back COVID.
Thank you so much, Dr. Chokshi, for your work as a health professional. Unfortunately, due to an unforeseen scheduling issue, the Congresswoman will be unable to join us for this evening. I want to thank Dr. Chokshi for joining us and sharing his knowledge and insights. I will share a few resources for tenants and homeowners and then close out for the evening. Thank you so much, Dr. Chokshi. From October 31st to May 31st, the city requires building owners to provide tenants with heat if it falls below 55 degrees. If you don't have heat and your landlord refuses to fix it, call 311. If the problem is not fixed quickly, you can also file a complaint online, and we'll drop that link into the chat. They will send out an inspector and cite the landlord. If the landlord still doesn't fix it, then the city has the responsibility to fix it and send the landlord a bill. If you cannot afford the heating bill, or if you're a homeowner struggling with the cost of heating equipment maintenance repairs, the Home Energy Assistance Program can pay for fuel, your utility source, heating equipment replacement, and repairs. Applications are now open and close on March 15th, 2022. Once again, you can refer to the link in the chat for this information. If you do find yourself without heat, here are some tips on how to keep your home safely. Never use a stove, oven, or charcoal grill to heat your home. Kerosene heaters and propane space heaters are illegal in New York City. If you use an electric space heater, only plug it in directly to the wall outlet. Unplug space heaters when you leave the room or go to sleep. Place space heaters at least 3 feet away from anything that can catch fire, such as curtains or tablecloths. Do not hang clothes over a space heater to dry. And once again, you can refer to the chat for the links that I talked about. On Saturday, January 15th, the ban on evictions in New York expired. If you are facing eviction, there's immediate help available. Apply to the Emergency Rental Relief Program, and you will be immediately protected from eviction. We'll drop the link to apply in the chat. You'll see a note on the website that there are currently no additional funds available for this program. However, when it comes to protecting you from immediate eviction, that doesn't matter. If you can show your landlord you've applied to this program, you legally cannot be evicted. What about the long term? Both the state and the city have asked the federal government for additional funds for this program. If they receive it, then through this program, they'll work with you and your landlord to pay overdue rent. There are also other rights to be aware of with regards to evictions. Lockouts, also known as unlawful evictions or self-help evictions, are illegal. All tenants, including those in private residential programs, have the right to stay in their home unless they choose to leave or are evicted through a court process. Under New York City's Right to Counsel, RTC law, legal services are free, available in every zip code, and available regardless of immigration status. DSS/HRA's Office of Civil Justice, known as OCJ, ensures tenants facing eviction in housing courts, or NYCHA, administrative proceedings, have access to free legal representation and advice provided by nonprofit legal services and organizations from across the 5 boroughs. There's a new program now available for homeowners. The New York State Homeowner Assistance Fund, NYSHAF, is a federally funded program dedicated to assisting home ownership who are at risk of default, foreclosure, or displacement as a result of financial hardship caused by the pandemic. Support from NYSHAF could look like financial support to address delinquent housing payments that result in affordable outcome, access to a call center and case managers who can help you find out about any mortgage relief you may be entitled to and how it will affect your future housing payments, and referrals to professional housing counselors or legal services providers who are experts in their fields. Applications will be processed in order that they were received. NYSHAF expects to receive significantly more applications than can be funded by the program, so make sure to apply as quickly as possible. Thank you so much for listening to my comments on how to heat your home safely, as well as eviction notices. Now, we were going to be moving into the press gaggle, but by the unforeseen circumstances that led to the Congresswoman not being able to attend this. I would just like to thank you all for attending this town hall, as well as just remind the press that there is no gaggle. So thank you so much to our constituents for asking questions. And thank you, Dr. Chokshi, for joining us this evening. You can always contact our office by calling 718-662-5970 for Ocasio-Cortez, or visit our website at ocasio-cortez.house.gov/contact. Below is our social media information as well. Thank you so much for attending. Have a wonderful night.